All right, next we're going to move into tactile receptors. So we've already talked about one of these when we talked about epidermal cells. We talked about these Merkel's cells or Merkel's discs, and we want to add on to that. All right, so the things that we want to look at really quickly just to knock this one out. If someone's ever walked up behind you and like maybe taken a piece of paper to the back of your hand or the back of your arm or something or the back of your neck, and you feel those goosebumps and you feel that hair stand up. So there's receptors associated with this arrector pili that we talked about back here. So these receptors can also function in touch. So not only does this arrector pili function whenever you're cold, it also responds to things like tactile stimulation, which is touch. So tactile means touch. And I just want to knock this out so we can stop looking at it. This arrector pili, we have receptors associated with that. So now I want to look at these three. And the things that we want to ask ourselves is, where are these located and what kind of touch, what kind of stimulation do they detect? Merkel's cells, Merkel's discs, we've already looked at this. We said that they're at the epidermal-dermal border, but they're on the epidermal side and they're located in that stratum spinosum, that spiny layer. These are going to detect light touch. Meissner's corpuscles, so these are on the epidermal-dermal border, but they're on the dermal side. What's that first layer? We have a superficial and a deep layer of this dermis. So what's that superficial layer called? This is the papillary layer. So Meissner's corpuscles are located in the papillary layer and they respond to light touch. These last ones are Pacinian corpuscles. So these are in the deep dermis and that reticular tissue. And these respond to deep pressure. One interesting about the Pacinian corpuscles, these adapt. So what does adaptation mean? It means that they're going to stop sending signals to the brain. So you can try this on yourself or on someone else. If you go ahead and push into your trap in your back, you'll feel it. Maybe it's pretty sore. If you hold it there for about 10 to 15 seconds, eventually that pain goes away. That's this signal adapting, so it stops sending signals to the brain. Another example of this is when you sit in an uncomfortable chair for a while. After a while, you don't feel as uncomfortable. It doesn't feel as hard on your butt, and that's because these Pacinian corpuscles have adapted to this pressure. Okay, so we've written this out. Let's do a picture form this time. So instead of drawing that flat layer this time, instead we'll draw these papillae. And I know that we said that we have a basale, some spinosum, some granulosum, and some corneum. So let's add our Merkel's discs now. So the epidermal-dermal border, that's this thing right here. And on the dermis side, we have this loose connective tissue and the papillary layer. And now I have these tactile receptors, and these are called Meissner's corpuscles. I encourage you to practice saying these words. It'll help you on the test. And then we have this dense irregular connective tissue making up that reticular layer. And here we're finding these Pacinian corpuscles that are responding to the deep pressure. So, once again, Merkel's discs, Merkel's cells, Meissner's corpuscles, Pacinian corpuscles. What do we have? We have 1 on the epidermis side, 2 in the dermis, and then we have 2 responding to light touch, and then 1 for deep pressure. So this is a mental map that I like to use on the test. It has all the things that you need. It has the names of the cells, the locations of where they're at, and the type of stimulus that they respond to.